Hello. We are back with the Mocha Vets. I'm Dr. Morris with Botanical Vets.
I'm Dr. Armstrong, the modern vet.
And we are here for episode number 2. Is it an emergency or not?
So we are so excited for this episode. We're coming with the ER and then the GP, the general practice. So it's going to be fun. Stay tuned and let's get started.
Going down in the hind end, so no longer able to use those back 2 legs. Is that an emergency?
That's definitely an emergency. Anytime we get a call that says, all of a sudden my dog is not walking, he's dragging his back end, we tell you guys to get into the ER ASAP. Reason being is because there's obviously been some compromise to the spinal cord. There could be a number of reasons why that can happen. So IVDD, or intervertebral disc disease, is the most common cause for dogs to be acutely down in the hind, and acute meaning like it just happened suddenly. But like I said, there are plenty of other reasons. Regardless of the reason, you have to get them into the vet immediately, preferably the ER, and preferably like a specialty referral hospital if you guys have one nearby. They will do some imaging. They'll recommend imaging, x-rays, MRI. MRI is the best to figure out what's going on in that spinal cord. And they may or may not recommend surgery, emergency surgery, based on what they find. So if measures aren't taken to get the care that that dog needs, like right then and there, then there's this window of opportunity where it's like we can potentially save the nerve function. And you might, your dog might be able to regain function, or it might not. And so you might end up with a dog who's like forever paralyzed.
Yes.
So it's not a pretty thing to deal with at all. And it sucks whenever pet owners don't know this, and so they delay for whatever reason. I don't know, because me personally, if I saw somebody dragging their upper body, I'm like, what's up, 911? You know what I mean? So if I saw my dog like that, I would do the same thing and just get them the care that they need. And pet owners, if you cannot afford to do all the tests, to do the surgery if it's recommended, things like that, because a lot of the times it's like $6,000 to $8,000+ for hospitalization and everything. And if you can't afford it out of pocket, that's okay. Euthanasia is absolutely an option. Do not feel bad about that. And there are some other options, such as medical management, using steroids and things like that. Oftentimes the neurologist will kind of try to work with you and figure out what's best. Again, it depends on the underlying issue. And then, there are wheelchairs and things of that nature. So there are options, but of course, best case is for surgery, is for the MRI, etc. And if that is simply not doable, then final care. It's okay.
And the other thing, just to add to that, is now, like traditional Chinese medicine is more common now, more holistic practices. So some things that I have done for other paralyzed patients in the past was electroacupuncture. So this is a more intensive stimulation to that. But again, the key factor is getting in as soon as it happens, right? And in some cases, it works fantastic. We have dogs who have fully recovered. In other cases, we are not as successful as we would like to be. But like Dr. Armstrong was saying, for sure, surgery.
Right.
Can
Again,
definitely
it depends on
help
the
a lot
cause,
of
right?
Exactly.
Yeah.
Exactly.
Yeah. But
Exactly.
Can you share some more on about the patient that you had? You told me about this patient. Acupuncture literally saved this dog's life. Let's hear it.
Oh my gosh. Okay. So it was like a 5-year-old, beautiful little wire hair Dachshund Terrier mix, and had for some reason gone down in the hind end. The owner noticed like something was a little bit off with the jumping, but still moving. And then by that second or third day, completely paralyzed, no sign of deep pain at all. Went to the vet, got all the options, but could not, unfortunately, afford the imaging or the surgery that could follow that. And they did talk about euthanasia as an option, but then she had also saw on one of the Facebook groups, they talked about acupuncture. So she called, we went in for our first session, and we of course talked about, this is my protocol. We're basically gonna throw the kitchen sink at it. There's a few other points that I've seen online, and we're gonna do some high stimulation of those hind limbs. And literally when I tell you, we started one day of the week, and I came back for the follow-up the next week, and this dog literally walked out the cage, and I was
That's
like,
amazing.
Okay, let's keep going. We're still a
Right.
little wobbly, but we just followed those same points, right? They also had some laser therapy, some physical therapy as well that kind of helps, but this dog was at least up and moving around.
Yeah, that's amazing. And so I'm so glad you brought it up because it just reminds us that just like in human medicine where we have the different approaches, the same now is happening in vet med. So there's the traditional way of going about things, or the Western way, and then you have like the more like integrative, alternative Eastern approaches to doing things. And so ultimately, I think it's a nice blend sometimes. A nice way to approach certain cases by blending both practices. I personally have no expertise in what Dr. Morse does, but so I love hearing her stories. It's just amazing. I'm kind of like, do this, or no, I'm just kidding. The book says. Yeah, so
for us, though.
Right. And I mean, like, I'm very much open to it, but I just love hearing Dr. Morse's stories about these things. Yeah.
Yes, our second question, an ear infection, emergency or not?
Definitely not.
No.
Definitely not. No.
Unfortunately. Yes, no. So on the GP side of things, when you hear that their patient is shaking their head excessively, scratching, maybe got a little slight head tilt, you can see some redness of the ears, maybe a few abrasions from the actual scratching, some discharge, a smell. This would warrant a visit to your primary veterinarian, right? So let's not try to monopolize some of the time at the ER, save you some money, and then just go in. Our standard of care is go ahead and get us a few samples, doing some in-house cytology, seeing if it's yeast, if it's bacteria, what type of bacteria it is, and then using that information to prescribe you the needed medication, whether it's a wash or some ear drops, doing an in-house cleaning for you, and then followed by a checkup like 7 to 10 days later.
And here's the thing. Exactly what you described is what we would do. But it's going to cost so much more because it's an emergency setting, right? And it is what it is. And not only that, but because you're coming into the ER where their chances of there being more critical patients are higher, you are going to be sitting in that parking lot if it's curbside for probably hours. All right. Because meanwhile, we have the hit by cars, we have the dogs that are paralyzed in the back end, things like that. They take priority. So if you can avoid going to the ER for an ear infection, please do so. So what would you do in the meantime? If you notice that your dog's like starting to shake the head and scratch the ears, the e-collar.
Every time. Do not let it get worse.
Exactly.
By doing that. Or if you know that you have been kind of slacking on the maintenance ear cleaning, you have some non-medicated ear cleaning, go ahead and flush the ear out. Get some of that excess debris and wax that is likely built up in there, and put the collar on until your visit.
And call your vet. Your vet.
One thing, do not clean the ear before the visit.
Ooh, yeah. Tell them why.
That's just because you're wiping out all of that good debris that we're going to use for our sample, and it can contaminate it.
Right.
But in the meantime, you have like 2 or 3 days to wait. Like, go ahead, a good time. Or if you're concerned, get in as soon as you possibly can.
Now I will say to the pet owner's defense, all right, that sometimes Dr. Morris, they'll call into the ER and say, hey, so-and-so is shaking the head, da-da-da-da-da. And it's like, have you called your vet? Right? Like literally that's what I say. Have you called your vet? Because it sounds like, and they'll say, well, I haven't, but I can't get in. They don't have any openings for weeks. That is, I get it. That's a thing now, right? So what do you do in that instance? Well, number one, you can try calling around for different hospitals and see, hey, is it possible I can get in? And then obviously just have your records transferred back to your original vet. Or it's like, okay, if you're going to go to the ER, please lower your expectations as far as when you're getting in and things like that, because it just might be a while. All right.
And honestly, you don't want to be the first person that they have to treat at an ER, because that means the prognosis is like,
that means that whatever you have going on is bad. So
just exactly.
Just relax in the car and let them do what they're going to do. Okay.
Yes.
And do not complain about the cause. It is the ER. Don't complain about the cause. Moving on.
So our next question, hit by car. whether they're walking or not. Is it an emergency or not?
It is definitely still an emergency. All right. So good question. If they're walking or not. So if they're walking, you might think, I think he's okay. Still have them evaluated. It's no different from you having a baby, him tumbling down the stairs, and he still gets up. He's like, Mama, you're probably still gonna have him checked out because you just never know, right? There's internal bleeding that could happen. You know, maybe they start collapsing later because they were hemorrhaging out somewhere. You know what I mean? You just don't know. Right. And dogs are so good at hiding their pain. And sometimes, especially those labs, those goofy breeds, like they're like, I don't even know what's going on with me, right? It's like, I've collapsed. So
yes, I've literally seen a black lab mixed dog come in, broken both hind legs, tail still wagging though. So like, hey.
Yes. Some of them are like that. And then obviously if there's clear injuries, then more than likely, you know, on the outside, more than likely something's going on the inside that you won't be able to tell. So bruising of the lungs or air in the chest, air that shouldn't be there, we call that pneumothorax, or bleeding into the abdomen, things of that nature. Sometimes brain injury, there will be some changes that you may not be able to perceive, but we will. So they should definitely be assessed in an ER setting and more than likely be hospitalized.
Exactly. And then also, just to pay back on that, don't be afraid to let us know what happened. You know, we're not going to judge you. We understand accidents happen, dogs hide behind your car.
If you ran over your dog, just tell us, okay?
Yes.
Judge you.
No, honestly, it happens probably more often than you think. And it's an accident. It's an accident. But either way, we're here to help you do that.
Exactly. Remember, just like we said in our first video, open communication is key, okay?
So our next question, skin, anything.
Ooh, Lord.
Is that an emergency or not?
Definitely not.
Definitely not, right? But there's exceptions to this.
Okay, fine. Tell me your exceptions, Dr. Boris. Tell me why I should let this skin dog come in the ER.
It's like a laceration, right? Skin flapping off in the wind.
Right. That's fair, right.
But if it's your typical possible insect bite, maybe a little yeasty looking odor between the paws, got a little a hot spots, you know, maybe some things that could be resolved with some general hygiene practice, bathing and things of that nature, then it's likely could wait.
Right.
Likely. And typically with those injuries, yes. And typical skin injury, it doesn't just pop up overnight. Now, if it's like an allergic reaction, like hives, and you start seeing facial swelling, things of that nature, that is an emergency, right?
Right. Exactly.
But yeah, typical skin, little pustules.
We'll have you waiting in the parking lot. Let's just say that. No, I'm just kidding. I'm just keeping it real. Now, when in doubt, still always call your primary care veterinarian. Just be like, so-and-so developed this rash, or so-and-so is like itching excessively. Should I come in or not? And let's just say your vet has no appointments. They'll be like, just send me a picture. And then they will let you know whether to go to the ER or not, because your doctor will know best. You know what I mean? But for the most part, as Dr. Morris said, if you see a little pustule that just pops up on the leg, like, not show up in the parking lot, or you will be sitting there for hours until we can get to you. So,
yes.
Oh, and I was just gonna say, the other thing too is not, we're not being like difficult or anything like that. It's truly because we are flooded, we are swamped, and we are gonna take the sickest patients first, the most critical first, before we get to the skin. All right. Not only that, but I mean, not all the time are ER hospitals equipped with the medications that, say Dr. Morse would have in her general practice setting. So,
True.
Yeah.
And then what you can do in the meantime, color. E-collar every time.
E-collar, yes.
Because the licking, the scratching, it can make it worse. It can make it worse.
Yes.
And I get it, like licking in the middle of the night, not ideal. But again, that e-collar.
Right.
Definitely e-collar on.
Agreed.
Seizures. Is that an emergency or not?
Definitely an emergency. Okay. Anytime your dog is having a seizure, do not just sit there and watch him or record him for the gram. Please don't do that. Call your vet or whisk his little buns to the ER, okay? Unless you like, especially if it's a first seizure, if you have no idea that your dog is having an issue but you're like, that's definitely a seizure, ER, okay? Let's just say your dog has a history of seizures and you've had this conversation with your vet as far as what's normal and what's not. Stick by that to the T. Two things that warrant like straight up visit to the ER, even if it's 2:00 in the morning, is if their seizures are lasting more than like 3 minutes or so, 2-3 minutes. And especially like going into 5 minutes, please do not wait. Like 1000% emergency. Or if they're having like more than 2 seizures within a 24-hour period, okay? Yeah. Both of those criteria meet like drop what you're doing, okay? You know, if your hair is not done, who cares? We don't care. We're probably not going to see you sitting in the parking lot. Just go. Yeah, like those 2 things are definitely emergencies. So I will tell you of a case where this family had their dog seizuring in their home for 3 hours straight. 3 hours straight. And no judgment, they didn't know. They did not know that was an emergency. And so by the time the dog got to me, there was nothing that I could do. The dog was gone. So unfortunately we had to perform final care, but it was terrible. Like they literally said we had no idea. So that's why we're making these videos so that you guys will know, okay?
Sometimes you don't know what a seizure looks like, right?
Good point.
So you're just like, I don't know if you're just twitching, is that a really bad itch?
Right.
It might not be always as aggressive as you might think it might look in humans.
Agreed. And I love telling pet owners to like record things because it makes it so much easier for us to get an idea of what you're talking about, right? So
exactly. Videos and pictures are always the plus. It helps us help.
Yeah, exactly.
Okay, so moving on. Coughing. You know, is that an emergency or not?
It depends. That one's kind of like
yeah.
It really depends. So for example, all right, let's just say your dog has been at a daycare, going to the kennels, boarding, grooming, whatever. And like a day or 2 later, they're home and now they're starting to hack. Okay. They're more than likely they picked up some kind of upper respiratory infection. However, if they're still bouncing around and eating and drinking okay, I would just say, let me call my vet first thing in the morning and let them know what's going on and see if I can get them in. That's what I would do. Okay.
Yes.
I wouldn't just show up in the ER. Okay. Now, if you have a dog who is like, let's just say 10, 11 years old, and they're coughing, and they're coughing some more, and now they're coughing in their sleep, and they can't seem to get uncomfortable. And not only are they coughing excessively, but it seems like their breathing is a little bit off, right? It just seems like there's more effort when they're breathing and they're very uncomfortable. I would probably go to the ER, okay? Because there's probably something very pathological going on in their chest, whether it's their lungs or their heart. So that's definitely an emergency.
Ooh, yes. And even just like hearing you say that, if they're coughing up like fluid or blood is coming out or something abnormal looking, definitely more sign for emergency.
Just definitely go. What drives me up the walls, and I'm keeping it real, is whenever I'm getting a history from you guys and, you know, let's just say is, coughing up blood. Well, how long has this been going on? Oh, for like 5 days. Oh my gosh.
No.
So would you sit in your home for 5 days coughing up blood and not call your doctor? You know what I mean? Please don't do that, because then that makes our job a little bit harder as far as doing what we need to do to get them right. Because by that point, like, they're sicker. Okay, they're sicker. So
the sooner the better, because when we get treatments, get the coughing, a secondary inflammation under control, and hopefully figure out what's going on.
Right. Exactly.
Versus having an actual emergency leading to collapse.
Oh God.
Hair. You don't want to go through that.
And we don't want to go through it either. It's awful.
So those were just a few of some of the most common concerns we've seen owners have, some of the confusion as well, and want to discuss with you whether or not those were emergencies or not. I hope that this at least made it a little bit more clear to you.
I got a bonus for you.
Oh, what is it?
The bonus is vomiting and diarrhea. Vomiting and diarrhea. Like,
is it diarrhea, or is it like
really exactly. But I would say, honestly, on an ER basis, that is probably the most common reason for people to come in: vomiting and diarrhea. So it's either they're just vomiting, or they're just having diarrhea, or it's both. So at what point do you say you definitely could have just called Dr. Morris the next morning? You know what I mean?
Yes. And it's weird because that criteria is like, it's vague, but it could also be something serious. Now, if it's like a little puppy and we're vomiting and having diarrhea with plus or minus blood, definitely. Especially if it's a lot and it's frequent, it's a little bitty baby. You don't want them to lose that much fluid in such a short span of time. Something else could be lurking that definitely needs emergency.
Parvovirus, right? Yeah.
Yes.
But as far as like vomiting and diarrhea, as you said, it can be something benign, or it could be something that's indicative of something more dangerous, right? More sinister. And that's the funny thing with vomiting, diarrhea. Like, we never really know sometimes, because I consider them nebulous clinical signs that can fit the script for just about any disease process. You know what I mean? So when do you wait? When do you go in? I personally, and tell me if you agree, would say if they are having little diarrhea here and there, but they're eating, drinking, bouncing off the walls, and there's no blood in it, then I would just say, let me just call my doctor the next day.
Exactly.
If they're having diarrhea and it's a lot of fluid coming out, like water, projectile diarrhea, and or there's blood, maybe, still call your doctor, but probably ER.
Exactly. Ooh, and then just to add a few more tips in there. So when you come to and you have, your little furry companion, they're gonna ask you some questions. It's always good to at least know what color, around about how much, is there a weird smell? Is there something in it? Right? Just to kind of give us a little more information that we can use for our diagnosis.
Right. Yeah, absolutely. And especially with like trying to figure out how much they're losing, how much diarrhea there is because we need to get an idea of fluid loss, because they can get dehydrated quickly. Have you ever had the runs? You know what I'm saying? Like, you just wanted to drink because you just get a little parched. You know what I mean? So that's kind of how they are too. And I mean, they can drink, but sometimes they don't get to intake as much as they're producing, right? So there's that. Now, as far as vomiting, again, if it's like one little vomit here and there, but they're still zooming and acting, their normal cells are still eating, I would say, okay, maybe you can call your vet, the next morning and blah, blah, blah. However, if it's vomit after vomit after vomit, if they're starting to slow down, that's a problem. If they vomit and you see pieces of toys, guys, do not wait. Chances are they ate something and now it's causing obstruction. Exactly. So just
get that surgery money together.
I know, exactly. Don't wait for that. Okay. No. But again, like one little vomit here and there, you can probably just call your vet and just be like, hey, should I come in? Can I get an appointment? And they will let you know when to go to the ER as well.
Yeah, exactly.
Vomiting and diarrhea. Sometimes you just never know.
You honestly, you really don't. But yes. Let us know if this was helpful for you. Also, let us know if there's something else that you wanted to hear more about. Put that in the comments.
Yes, please do.
Any feedback is always, welcome. We want to at least be able to perfect this for y'all and make it a funner, better experience. I don't think funner was a word, but we're going to go with it.
We're going to make it a word. Okay. We're going to keep it entertaining. Yeah, that's the whole point of this, like just to have fun, just sit back with us and let's just talk and laugh.
Yes.
And make fun. And good. It's all love.
And we've all gone through it before. We weren't always best, so.
Exactly.
Don't be so hard on yourself.
Yeah. Unless we tell you.
All right.
gosh. Yeah, it was always a pleasure. It's a pleasure. It's a pleasure.
Yes. So we will talk to y'all next time. Stay tuned for our third episode.
Yep. All right. Bye.
Bye.